Peripheral neuropathy slowly degrades the body's communication network. It usually begins with a subtle numbness or a tingling sensation in the hands and feet. Over time, that numbness can escalate into chronic pain, muscle weakness, and in severe cases, dangerous foot ulcers that require amputation. Right now, this condition affects roughly 1 to 3% of the general population. If you look at the patients suffering from this nerve decay, you'll immediately notice a glaring inconsistency. You have 70-year-olds walking around with perfectly intact, highly responsive nervous systems. Meanwhile, some 50-year-olds are experiencing rapid, aggressive nerve degeneration. If peripheral neuropathy is simply a disease of old age, the math doesn't add up. To figure out what's actually driving this decay, researchers turned to the National Health and Nutrition Examination Survey. This flowchart outlines their screening process, which ultimately allowed them to isolate the detailed health records and lifestyle habits of 7,860 American adults. The data revealed that chronological age isn't the primary culprit. The real driver is biological aging, how fast your cells are deteriorating on a molecular level. And that biological clock is heavily controlled by the specific combination of foods you eat every single day. Nerve degradation is a direct metabolic breakdown, engineered by our daily dietary choices rather than the simple passage of time. Scientists measure this impact using the Dietary Inflammatory Index, or DII. This is a scoring system that calculates the exact inflammatory potential of everything we consume, categorizing specific nutrients by how aggressively they trigger or calm inflammation in the body. When you consume meals heavy in saturated fats, cholesterol, and omega-6 fatty acids, you drive your score upward. You are actively loading your system with compounds that provoke an immune response. Now, at low to moderate DII scores, you're fine. Your body has internal defense systems, like the IL-10 signaling pathway, which produce anti-inflammatory proteins to neutralize the dietary stress and keep your nerves protected. But that internal buffering capacity isn't infinite. It has a rigid mathematical limit. Once your dietary inflammation exceeds that limit, the defense system fails entirely. Human dietary risk does not operate on a straight line. We don't accumulate damage slowly with every bad meal. Instead, we remain totally safe, right up until the exact moment that we completely overwhelm our body's latent biological defenses. Look at this graph mapping DII scores against the actual prevalence of peripheral neuropathy. The data forms a distinct J-shaped curve. Notice how the risk remains flat across the lower scores, but then abruptly takes a sharp upward trajectory. That vertical red dotted line represents the specific tipping point, a Dietary Inflammatory Index score of exactly 1.295. Once you cross that threshold, your odds of developing nerve damage skyrocket. The physiological consequence of crossing that line is immediate. Your overwhelmed defenses give way, and a flood of chronic, low-grade systemic inflammation washes through your entire body. This mediation model maps out exactly how that systemic inflammation does its damage. It accelerates a metric called KDM biological age. Simply put, this high inflammation diet artificially ages your body's physiological systems, and as you can see here, that accelerated biological aging accounts for nearly 20% of the link to nerve decay. This biological cascade usually starts in the stomach. The high inflammatory diet disrupts your gut microbiome, killing off beneficial bacteria and breaking down the integrity of your intestinal walls. With the intestinal barrier compromised, bacterial toxins leak into the bloodstream. They circulate until they breach the blood-nerve barrier, allowing immune cells called macrophages to swarm in and physically strip away the protective myelin sheath coating your nerve fibers. Exceeding a DII score of 1.295 transforms the human body from a resilient, defensive state into an accelerated aging machine. It actively digests its own neural wiring. In this biological context, your diet serves as the primary physical armor protecting the nervous system's delicate wiring from premature decay. Contrast the accelerated aging of a high DII diet against the longevity of anti-inflammatory routines. One accelerates cellular degradation, while the other maintains structural integrity. Lowering your score requires specific nutrients. Omega-3s, B vitamins, zinc, and selenium actively bolster internal defenses, pulling your score downward. You also need a heavy intake of diverse dietary fiber. Fiber feeds the microbiome, which in turn reinforces that crucial intestinal barrier, stopping systemic inflammation before it can even initiate. Simultaneously, removing heavily processed carbohydrates and saturated fats keeps the inflammatory load mathematically below the 1.295 danger zone. Chronological age is unstoppable. Every year you will get older, but strictly managing your dietary inflammatory index provides a proven method to halt accelerated biological aging, keeping your body safely below the threshold of destruction and preserving your nerve function for life.